By the time your kidneys actually start to scream for help, it's often far too late to reverse the damage. These organs are the most polite, silent workers in the entire human body. They perform their duties in total obscurity, processing nearly 200 quarts of blood every single day, never complaining until nearly 90% of their functional capacity has been permanently destroyed. This is why medical professionals often refer to chronic kidney disease as the Great Silence. For those of us over the age of 60, these two bean-shaped powerhouses have been filtering toxins, balancing minerals, and regulating our blood pressure for over 6 decades. The wear and tear isn't just a possibility, it is a biological reality. Think about a typical Tuesday morning in your household. You wake up and perhaps you notice your eyelids feel a bit heavier than usual. You take a sip of water and there's a strange metallic tang on your tongue that wasn't there a few months ago. You realize you've been getting up 3 or even 4 times a night to use the bathroom, disrupting the deep sleep you so desperately need. Like most people, you probably brush these moments off. You tell yourself it's just the price of admission for getting older, or perhaps a minor side effect of that new blood pressure pill. But what if these weren't just random senior moments? What if these were the desperate final SOS signals of a filtration system that is beginning to collapse under the weight of decades of service? In this comprehensive guide, we are going to dive deep into the 13 silent, almost invisible signs of kidney failure that people over 60 are ignoring every single day. We have refined the way we look at these symptoms because the standard medical checklists often fail to catch the nuances of the early stages. Specifically, you must pay close attention to sign number 3. This particular symptom is frequently mislabeled as early onset dementia or senior fog, leading thousands of families down the wrong treatment path, while the kidneys continue to deteriorate in the background. Before we proceed, I want to be very direct and clear. This content is designed for educational awareness and patient empowerment. I am not your personal physician. If you recognize these patterns in yourself or a loved one, you must request a specific renal blood and urine panel from a specialist immediately. Early detection in your 60s is the absolute boundary between a manageable health condition and the total life-altering reliance on dialysis machines. Now, let's uncover the clandestine signs your body has been trying to tell you. Sign number 13, the broken biological clock, Nocturia. For the average person over 60, interrupted sleep is almost an expectation. Men often blame a growing prostate, women blame a weakening pelvic floor. However, there is a specific type of nighttime urination, known as nocturia, that points directly to the kidneys rather than the bladder. Imagine a 65-year-old man who, for his entire life, could sleep 7 hours straight without moving. Now he finds himself staring at the ceiling at 1 a.m., 3 a.m., and again at 5 a.m. He isn't drinking extra fluids before bed, yet the volume of urine he produces is surprisingly high. Why does this happen? Inside your kidneys are millions of tiny filtering units called nephrons. In a healthy body, these nephrons respond to an antidiuretic hormone at night, which tells them to concentrate the urine so you can sleep. When the kidneys are damaged, the nephrons lose their sensitivity to this signal. They essentially leak water 24 hours a day. They can no longer hold the fort during the night, forcing your bladder to fill up every 2 hours regardless of your intake. According to the Journal of Urology, this loss of concentrating power is frequently the very first clinical indicator that the internal architecture of the kidney is under extreme stress. Sign number 12, the soapy surface, albuminuria. The next time you use the restroom, I want you to do something most people find uncomfortable. Don't flush immediately. Take a moment to look at the water. If you see bubbles or foam that resemble the head on a glass of beer, or thick, soapy suds that require multiple flushes to disappear, you are witnessing a structural failure of your body's filters. Picture a grandmother who notices that no matter how often she cleans the toilet, the water always looks sudsy after she uses it. This isn't a reaction to a cleaning chemical. Those persistent bubbles are actually protein molecules, specifically albumin, that are escaping your bloodstream. To understand this, think of your kidney's filter like a high-tech silk sieve or a very fine window screen. It is designed to let tiny waste molecules out while keeping large, vital proteins like albumin inside your blood where they belong. When that screen gets holes in it due to high blood pressure or diabetes, the protein falls through. This isn't just a weird observation, it is a direct visual confirmation that your kidney tissue is physically breaking down. Research in the Journal of the American Society of Nephrology confirms that persistent foamy urine is one of the most reliable predictors of progressive, irreversible kidney scarring. Sign number 10, the pillow prop breathlessness. Have you noticed that you've started using an extra pillow or even two to prop yourself up at night to breathe more easily? Or perhaps you felt winded just walking to the mailbox, despite your heart being cleared by a cardiologist. Imagine a man sitting in his favorite recliner, his chest heaving slightly as if he just ran a sprint, even though he's been sitting still for an hour. When the kidneys fail to remove excess fluid from the body, that extra water has to go somewhere. Because of the laws of physics and circulation, that extra water often backs up into the air sacs of the lungs. This is known as pulmonary edema. It is particularly deceptive for those over 60 because it mimics the symptoms of congestive heart failure or a persistent chest cold. If your breathlessness feels significantly worse when you are lying flat on your back, it is a high-level warning that your kidneys are failing to manage your body's total fluid volume. It is essentially drowning from the inside, and it requires immediate medical intervention. Sign number 9, the morning mirror puffiness, periorbital edema. We often wake up with bags under our eyes and blame it on a restless night or a salty dinner. However, there is a very specific type of puffiness that is a classic kidney red flag. Think about looking into the mirror at 7 a.m. and seeing your eyelids so swollen that you can barely see your lashes. This is called periorbital edema. It occurs because the kidneys are leaking massive amounts of protein into your urine. Proteins like albumin act like a magnet that keep fluid inside your blood vessels. When your blood protein levels drop, the fluid leaks out of your veins and settles in the softest, thinnest tissues of the body, and the skin around your eyes is the thinnest we have. Unlike heart-related swelling, which typically stays in the legs due to gravity, kidney-related protein loss often shows up in the face first thing in the morning. If this puffiness seems to drain away as you stand up and move around during the day, it is almost certainly a filtration issue. Sign number 8, the ankle indentation test. By the time you reach the evening, I want you to take off your socks and examine your ankles. If there is a deep, indented ring left by the elastic of your socks that takes several minutes to disappear, you need to perform the pitting edema test. Sit on the edge of your bed and press your thumb firmly against the bone of your inner ankle for 5 slow seconds. When you lift your thumb, does a deep pit or crater remain in the skin? In a healthy person over 60, the tissue should be resilient and snap back to its original shape instantly. If that hole remains, it is a sign that your kidneys are failing to regulate sodium. When kidneys can't flush out excess salt, that salt stays in your tissues and pulls water towards it like a magnet. This pitting edema is the physical manifestation of a filtration system that has been completely overwhelmed. The Mayo Clinic notes that while many seniors are treated for varicose veins, the underlying cause is often the kidney's inability to maintain the body's delicate water-to-salt ratio. Sign number 7, the metallic palate, uremic fetor. This is one of the most peculiar and distinct signs of kidney dysfunction, often noticed by a spouse before the patient even realizes it. It is a chemical change that alters the very environment of your mouth. Imagine sitting down for a dinner you usually love, perhaps a grilled steak or a piece of salmon, and suddenly the food tastes like you are chewing on a handful of old copper pennies or a piece of aluminum foil. You might also notice a lingering smell on your breath that reminds you of ammonia or a faint scent of urine even after you've just brushed your teeth. This is known as uremic setter. It happens when urea, a waste product that should be in your urine, builds up to such high levels in your blood that it begins to emerge in your saliva. Bacteria in your mouth then break that urea down into ammonia gas. This creates a literal chemical reaction on your tongue that ruins the flavor of food and can lead to a sudden, unexplained weight loss because eating becomes a chore rather than a pleasure. Sign number 6, the queasy morning syndrome. Most people with early-stage kidney failure feel relatively normal in the afternoon and evening, but their mornings are often a struggle with unexplained nausea and a lack of appetite. Think about a 70-year-old man who wakes up feeling like he has a permanent low-level stomach flu. He can't stand the thought of breakfast, and the smell of coffee, which he used to love, now makes him feel like he's going to vomit. This senior morning sickness is caused by the accumulation of uremic toxins in the bloodstream. These metabolic wastes act as a poison to the entire digestive system, irritating the lining of the stomach and triggering the brain's nausea centers. Because these toxins build up overnight while you aren't drinking water to help flush the system, the concentration is highest when you first wake up. If you are reaching for antacids every morning, you might be masking a kidney emergency. Sign number 5, the bone-deep itch, uremic pruritus. This is not the kind of itch you get from dry winter air or a new brand of laundry detergent. This is a deep, maddening internal itch that often feels like it is coming from inside your bones. Picture an elderly gentleman constantly scratching his back, his shoulders, and his shins until the skin is raw and bleeding. He's tried every moisturizer and steroid cream on the market, but nothing provides relief. This is because the problem isn't in the skin, it's in the blood. Healthy kidneys maintain a delicate dance between two minerals, phosphorus and calcium. When kidneys fail, phosphorus levels skyrocket because they can no longer be filtered out. This mineral imbalance, combined with the buildup of uremic waste, causes the nerve endings in the skin to fire constantly and incorrectly. Research in the International Journal of Dermatology reveals that uremic pruritus is one of the most distressing and frequently overlooked symptoms in the over 60 population, often leading to severe sleep deprivation and depression. Sign number 3, the nighttime knot, electrolyte imbalance. Do you frequently wake up in the middle of the night with your calf muscle or the arch of your foot locked into a painful, rock-hard knot that requires you to jump out of bed and stretch? While many people blame dehydration or lack of bananas, recurrent muscle cramping in those over 60 is a major sign of kidney-driven electrolyte chaos. Your kidneys are the master regulators of magnesium, calcium, and potassium, the three minerals that allow your muscles to contract and, more importantly, to relax. When the kidneys are dying, these levels fluctuate wildly. The muscles become hyper-excitable, snapping into involuntary spasms at the slightest movement. If you are experiencing these Charlie horses multiple times a week despite drinking water, your kidney's electrical control system is likely failing. Sign number 3, the imposter, the senior fog. This is the sign that destroys lives and families because it is almost always misdiagnosed. In the medical world, we call this uremic encephalopathy, and it is the #1 imposter of dementia in the over 60 community. Imagine your mother, who has always been the sharp, organized matriarch of the family, suddenly becoming confused. She starts forgetting where she put her keys. She loses the thread of a conversation halfway through, and she seems spaced out or lethargic during family dinners. Like most families, you probably immediately think of Alzheimer's. You start looking into memory care, you feel a sense of grief, and you assume her brain is simply failing. But here is the biological truth. The brain is the most sensitive organ in your body when it comes to blood chemistry. When your kidneys stop filtering out nitrogenous wastes like urea and creatinine, these toxins cross the blood-brain barrier. They literally cloud the neurons, interfering with neurotransmitter signals and causing the brain cells to swell. A landmark study from Harvard Medical School suggests a staggering number of dementia diagnoses in seniors may actually be untreated chronic kidney disease. The most terrifying aspect is that if the kidneys aren't tested, the dementia gets progressively worse as the toxin levels rise. However, the most hopeful aspect is that if kidney function is addressed or dialysis is started, this fog often lifts almost immediately, and the person's true personality and memory return. If a loved one is showing mental decline along with any other physical sign on this list, like itchy skin or puffy eyes, you must demand a GFR blood test immediately. It might not be their brain that is failing. It might be their filters. Sign number 2, the faucet malfunction, volume shifts. When it comes to your urine, it isn't just about how often you go. It is about the volume and the consistency. Picture a woman who notices that despite drinking her usual 2 liters of water a day, she's only producing a tiny, tea-colored amount of urine. This is a condition called oliguria, and it means the faucets of the kidney are physically closing up due to scarring. On the flip side, some people experience the faucet being stuck wide open, producing massive amounts of very pale, water-like urine. This means the kidneys have lost their ability to sort the water from the waste. The sieve is completely broken and everything is just pouring through. Both of these extremes indicate that the delicate valves inside your kidneys have been compromised. Sign number 1, the gasping sleep. Sleep apnea link. If you have suddenly started snoring loudly or waking up in the middle of the night gasping for air, and you never had sleep issues in your 40s or 50s, your kidneys are likely the culprit. There is a fascinating and terrifying scientific link between kidney failure and sleep disorders. When your kidneys aren't removing fluid during the day, that fluid settles in your legs. But the moment you lie down to sleep, gravity shifts that fluid. It travels from your lower body up toward your neck and throat, narrowing your airway while you sleep. This is called fluid shift sleep apnea. Furthermore, the buildup of uremic toxins can actually confuse the brain's respiratory center, leading to central sleep apnea, where the brain simply forgets to tell the body to take a breath. A study in the Journal of Clinical Sleep Medicine found that over 50% of people with advanced kidney disease suffer from this, yet most never make the connection between their snoring and their kidneys. Why kidney failure is so dangerous after 60? If you are over the age of 60, your kidneys have filtered approximately 3 to 4 million gallons of blood. They have processed every prescription medication you've ever taken, every dose of ibuprofen for your arthritis, and every environmental toxin you've been exposed to. Unlike the liver, which has a remarkable ability to regenerate itself, the kidneys do not grow back. Once a nephron is scarred or killed by high blood pressure, it is gone forever. The specific danger for our age group is that we have what doctors call comorbidities. We have a little bit of high blood pressure or a touch of the sugar. We assume our fatigue is just from our heart and our swelling is just from our veins. But you must realize that the kidneys are the central command. They control the pressure, they control the minerals, and they control the very quality of your blood. When they fail, every other system in your body, your heart, your lungs, and your brain begin to fail with them. Your Kidney Rescue Action Plan. If you recognize a cluster of these 13 signs in yourself or someone you love, you must act with a profound sense of urgency. Kidney disease is a sliding scale from stage 1 to stage 5. If you catch it at stage 2 or 3, you can live a full, normal life for another 30 years. If you wait until stage 5, your options are limited to a transplant or a machine. Here is exactly what you need to do starting tomorrow morning. Number 1, request the triple renal panel. Don't just ask for blood work. Call your doctor and specifically request 3 tests. Serum creatinine. This is used to calculate your eGFR, estimated glomerular filtration rate. Think of your GFR as your grade out of 100. If it's below 60, you have kidney disease. BUN, blood urea nitrogen, this measures the trash level in your blood. And AUACR, urine albumin to creatinine ratio. This is the most important urine test. It looks for the leaky sieve, protein we talked about. Number 2, the NSAID immediate ban. If you have any of the signs on this list, you must be extremely careful with NSAIDs like ibuprofen, Advil or Motrin, and naproxen, Aleve. These drugs are nephrotoxic. They are literal poison to a struggling kidney because they constrict the blood vessels leading into the filters. For a senior with kidney issues, even a few days of these pills can trigger acute kidney failure. Switch to acetaminophen, Tylenol, and only after consulting your physician. Number 3, the hidden salt audit. Sodium is the primary enemy of a damaged kidney. It raises the internal pressure of the filters until they pop. You must aim for under 1,500 milligrams of sodium a day. Check your bread, your canned soups, and your frozen meals. This is where the silent salt hides. Number 4, the piston control. High blood pressure is like a power washer hitting a delicate silk curtain. If your top blood pressure number, systolic, is consistently over 130, your kidneys are being blasted every second of the day. Controlling your pressure is the number 1 way to save your remaining kidney function. Number 5, the hydration Goldilocks rule. Do not blindly follow the drink a gallon of water rule. If your kidneys are already failing, drinking too much water can actually drown your system and cause your sodium levels to drop to dangerous seizure-inducing levels, hyponatremia. Ask your doctor for a specific fluid goal based on your GFR score. Remember, having one or two of these signs doesn't mean you're heading for a dialysis center tomorrow morning. Many conditions can cause fatigue or nighttime urination. However, when you see a cluster of these signs, such as foamy urine combined with an itchy back, a metallic taste, and a bit of senior fog, your body is giving you a final clear warning. Which of these 13 signs surprise you the most? Have you ever noticed that metallic taste or performed the ankle pit test and been shocked by the results? Please share your experience in the comment section below. We have seen hundreds of cases where one person's comment helped another realize they weren't just getting old, but actually needed a life-saving blood test. If this information helped you understand your health and your body better, please like this video and subscribe to our channel. We are dedicated to bridging the gap between complex medical data and your daily life, specifically for the over 60 community and their families. Share this video with your siblings, your spouse, or anyone you know who might be ignoring these silent signals. Knowledge is the first step toward health, but action is the only thing that protects it. Get that blood test, check your filters, and protect your future. Your kidneys have been working for you every second of every day for 60 decades. Now it's finally time for you to do the work for them. We'll see you in the next video.